Welcome everyone to the first Climate Change and Health webinar of 2022. I'm Corinne Schuster-Wallace. I'm a water health researcher at the University of Saskatchewan in Canada. I'm also Associate Director of Global Water Futures, and I'm the co-chair of the Working Group on Climate Change and Health within the Canadian Association of Global Health, along with Dr. David Zakas, who's also here online. I'm joining from Saskatoon, which is located on Treaty 6 territory. It's the traditional homeland of the Métis. And I invite everyone within and outside Canada to reflect on the First Peoples of the lands and waters where you live, work, and learn. Also, reflect on the importance of valuing our lands and waters as important for our ongoing health and well-being. For those of you who are not familiar with the Canadian Association of Global Health, it was established last year through a merger between the Canadian Coalition of Global Health Research and the Canadian Canadian Society for International Health. And if you want to check out our new website for more information, you'll see also how you can join if you're not already a member. The Climate Change and Health Working Group, was established under the Canadian Coalition for Global Health Research in 2018 and continues under the CAGH. So for those of you, again, who might be interested in finding out more or joining our group of volunteers, then you can reach out to Lauren or myself by email. And now I have the great pleasure of introducing a friend, a colleague, and a co-member of the working group, Dr. Päivi Apanathi. Päivi is an interdisciplinary researcher practitioner, and among her many accolades and experiences, she's currently working as a senior scientist at the Natural Resources Institute in Finland. Päivi's research interests focus on the interface between health and the environment, particularly climate change, but also other cumulative socioecological impacts on well-being of children and youth, and again, primarily in rural and Indigenous communities, and more importantly, perhaps, on how to strengthen climate resilience in these communities. So please join me in welcoming Päivi to discuss the status of Canadian global health research concerning climate change and child health. Over to you, Päivi. Thank you.
Thank you, Corinne. I'm just slowly sharing here the screen. Does it look right now?
Perfect.
Can you see it? Perfect. Thanks for having me here. I have been working with children's environmental health, which this technically is, since 2006, first as a practitioner and then later at school as a researcher, So I've been working with this for a long time. Both my second master's and PhD was on this. And over time, I've come to wonder if we are looking at our research or researching, if we're asking the right questions, if we're looking, when we're trying to create a different kind of society, are we doing our research the right way? And my focus is very much, as mentioned, in health promotion and bringing together different ways of knowing for better policies and that enable the communities to become as healthy and sustainable and resilient as they can be. And in this, I picked this picture here because it is actually illustrating a little bit what my concerns are. This I took when I got out of a hostel after I had been up north doing some research workshops. And when I opened the door and saw this, my first thought was that there was a forest fire, some massive forest fire somewhere. And that's because I've lived in BC for the past many years during the forest fire seasons. And it took me a couple of seconds before I realized that my rational mind recognized that it's November, I'm at the Arctic Circle, and it's minus 12 degrees, and there was snow around. But this whole disconnect for a moment made me realize that we really are influenced by our backgrounds, by our disciplines, what our work is focusing on. And maybe that is influencing sometimes too much, and it's good for us to step back and reflect. So I will be talking about climate change impacts on children. I'll be talking about why they are more vulnerable, and I'll be inviting you to think in different ways about the health of children. But I will be also talking about how do we frame the issues that we're looking at if we really want to generate positive change, and what can we do as researchers to create better climate change and health research. And there in the top corner, you can see a little bit where I'm coming from. I was trained as in the school of thought, I mean, in the Canadian community-based health promotion approaches. And even though we use population health statistics and appreciate and influence policies, I really focus a whole lot on that ground level research and issues. And getting into this topic on children, I assume that most of you are familiar with child health to some extent, but just to get a little overview, if you're interested in more in children's environmental health, which this is, you can Google it, and WHO has some excellent introductory facts about it. And I also I wonder if you know that Canada was leading in children's environmental health, both in practice and research, until 2011. And I have a little question before I get ahead, so I get an idea of how all of you are familiar, know this children's environmental health perspective, is how many of you knew that Canada had a children's environmental health strategy developed between 2003 and 2010, and that was initiated by the provincial environment ministers, and I believe the development was funded by the federal government. It was launched 2010, and then for political change reasons to scrap 2011 because a certain political change in the country that we don't need to talk about much more, but that's when the funding was cut in a lot of environment and health. And I am hoping to be part of this, getting us back to the lead. And for the record, Finland is even more behind in this, so there's something to be proud of. Anyway, so I wanted to see that. Can you show thumbs up if you have heard about, and thumbs down if you haven't heard about it? And if Lauren can tell me what the status is, so that I know how much I go into detail in things. So are there any thumbs down, people admitting that they didn't know that we had a children's environmental health strategy? Or
there's a few.
Okay, so good. So anyway, so what I wanted to talk about, just to highlight and bring forth here, is that kids are different from us because their bodies are developing, their physiology is developing. So their cells are multiplying incredible speeds, and that's all concerted and directed by these minute concentrations of hormones, and that makes them very vulnerable for all kinds of positive and negative external impacts. And there are those windows of vulnerability in that development, particularly in the fetal state or an early years, and then again when the hormones are rolling in the teenage years, that the susceptibility is even greater. But it's the key piece here to think and understand is that timings and these different exposures can make a detrimental effect, and they can make changes in epigenetics, meaning they influence how the DNA is expressed and translated, and what proteins are expressed, and they can create conditions that actually lead to disease either immediately or later in life. Those conditions can be reversible or irreversible, sometimes even some of them are transgenerational, and that's where we talk about transgenerational trauma, for instance. And but the point is that this is very complex, and there are all these different social and ecological stressors and influencers that impact the way the children develop. And for more than that is that they don't, while the systems are developing, they also have a longer life expectancy, longer shelf life, so that there is the changes that are happening now in the society are having a greater impact on them over a longer period of time. And they are powerless. So this whole thinking that I am presenting here is based on the United Nations rights of children. And now more into what it means in climate change is that children that are born today will experience impacts of significant climate change throughout their lifetime. So they will never experience the slow little climate change that was taking place when we were younger. And that's the reason why I feel that we have a moral and ethical responsibility as researchers and practitioners to do our utmost that they have at least some chance of having a reasonable life. And we can do that through our research and work. What bothers me still today, and is the reason for this talk, is that that we don't talk much about the vulnerabilities of children. And this was a quick search I just did actually yesterday. I did a search on CBC, and it shows that there are over 30,000 hits for climate change. When you add health to the equation, there are 10,000 hits. But when you add children's or child health into it, it's just 15, 17 articles. And that tells us, or at least to me, that there's something that we really need to be doing. There is plenty of research. Unfortunately, most of that research nowadays is done by pediatricians, which is wonderful, but they're publishing it in pediatric journals, and oftentimes nobody else reads them. And so the rest of us working in health don't get the same information of the studies and observations that they have done. Climate change has direct and indirect impacts on child health, and it influences the social determinants and biophysical ecological determinants of health of children. So there is a range of diseases. And here I want to also highlight is that a lot of times we talk about mortality, but what comes to climate change, I would suggest and argue that morbidity is probably much more important factor in and what needs research, because that influences significantly larger portion of the population and decreased influences in terms of decreased quality of life with chronic conditions and so on and so forth. For this particular group up here, who is mostly focusing on global health, I like to highlight that in the recent literature review, only little over 10% of the research seem to be from studying low-income countries and climate change and children's environmental health, children's health. So we have a huge gap there. In addition to that, and this is, I'm a biochemist by my first training and have some toxicology background. So it's the chronic disease and toxicology that originally got me into child health. But we now have more and more evidence that the pollution and climate change together are influencing our health, also like in ways that are really becoming serious. The problem we have now is that we have a lot of these papers that are written are often experts writing, reflecting on what they know in their area of expertise. But because it is so complex, there are very limited number of empirical studies, and which is, I think, a bigger concern. There is no systematic approach with the focus on child health, not even in the narratives that we tell. So we don't actually focus on it much. And this is part of the story and that I'm trying to create here for you. The overview is this is an example of a recent study, really recent. It was just published. They took about 4 million emergency room visits during the warm season in 47 different children's hospitals in the States, across the States. And there was a significant difference, increase in rates of the visits during the hot days. And the reasons ranged from dehydration to bacterial infections and ear infections. One of the interesting finding was that teenagers were primarily at the hospitals because of ear infections. And the small toddlers and under 5-year-olds were because of infectious and parasitic diseases, which could be this, that kids are more on the ground and all that, put things into their mouths. But all this kind of stuff we don't study. So one additional thing here was that they, of course, found that low-income families, I'm saying of course because of social determinants, but low-income families were significantly more at the seeking help. And I'm wondering if that's because of air conditioning, and they didn't bring that up, but I'm just thinking. But it's that type of research where we actually don't have, that we need more to demonstrate that we have a problem. However, I want to, before I get into all these problems and suggestions, what we could be looking at, I wanted to go through a couple of aspects about what are the issues with child health and climate change. And first, heat. Air quality is a massive problem in a lot of cases. Anybody in Canada who lives in BC is very familiar with forest fires and smoke from the north and the south, days to an end, which makes it hard to breathe. And if you are in the fire area, even worse. Ozone and smog, probably more in Toronto, although your air quality has improved in recent years. Pollen season is longer, and the concentrations in the air has been really, really dense over the past years when there has been those long heat seasons, not every year, but most of the years. Food security becomes an issue, and that's not just with the heat. We saw now with just with the roads being flooded and washed off in BC, the food prices and food shortages started to pile up fairly fast. Then there are the existing conditions that the kids have, and heart and respiratory diseases, and I don't know how many of you have been aware of that kidney diseases are very sensitive to heat. And then, like the pandemic here, emerging zoonotic diseases are just a few of the issues that we have. Ticks and others included. Then there are these other aspects. If we take a little bit more to the indirect impacts, is the water quality in flooding situations combined with the pollution. And just to highlight a couple of things that we don't talk much about. The studies are mostly in toxicology on the environmental side and very seldom crossing over to the human health side. Storm runoffs are significant polluters. Septic issues, this is more from the empirical, from the Okanagan Valley in British Columbia. When there were great floods, they have flooding almost every year now, and the more they have forest fires, the more there is flooding, because the ground can't take all the water when there is no forest left. Clear cutting being part of the problem too, but they have problems that septic systems are overflowing so that they can see the excrement in the river after the flooding. And the same thing could be partially because, I don't know if you're aware of that, when the wastewater treatment facilities are in flooding situations, they actually have a mechanism that bypasses the whole system, because if they let all the water into the system, it would create a permanent damage and much bigger damage. So they actually let, in the flooding situations, the wastewater treatment plants let all the flow go through straight to the waterways. And that's common practice, not just in Canada, but elsewhere. Mining tailings. Canada has lots of mines, and in 2012, when in Wales there was a great floods because of the rains that they see associated with the climate change, the tailings flooded. The cattle that was underneath, down in the pastures under the tailings, and those were historic tailings, so they had been dry and empty. The cattle started dying and having toxic reactions, and they monitored 82 times the acceptable lead levels in the sediment. So why this is a problem in children's environmental health is there is no safe level of lead for brain development of children. Then there is the water quantity. There's oftentimes mold after the flooding in the houses, and it's very hard to get rid of. Then there are the socioeconomic environments and impacts, which we saw now with the pandemics, and people losing their jobs or businesses, and so on and so forth. So that's the biophysical part. And I don't want to sound like gloom and doom. What I'm trying to do is to create an overview of the complexity that we're dealing with, because with complexity, we need to find new ways of looking at things. So we all know that kids have been demonstrating against with the school strikes, asking for action, because they can see this, for them, this is their life. And even though single extreme weather events have shown to have a significant negative mental health consequences, meaning eco anxiety and that type of things, and people getting scared of the wilderness and nature, it's the ongoing slow stuff and the awareness of climate crisis that is really taking toll and causing distress for kids. And there's one thing that this article, which is a systemic review on psychiatry and climate change impacts on child mental health, they highlighted that kids that are active, we think positive of going active and working, advocating against or changes for climate change practices, sustainability practices. Sorry, I'm losing the language here. It's showing now, and that's also my empirical experience with the students, is that the frustration that the kids go, or the youth goes and tries to do and demonstrate and do all these activities, and then nothing happens. It is having incredible impact, negative impact, because feeling lack of empowerment is one of the most detrimental things. Feeling lonely in your fear is influencing very negatively, and also impacting then chronic diseases. So those were the main things that I wanted to highlight, like bring together these different aspects of child health in the changing climate. And I want to use this relatively recent study, it's from 7 years ago, on systematic review. No, actually, this wasn't the systematic review. This was looking at the food security and undernutrition in situation in Africa. And I want to use this study as an illustration of where we may be going a little wrong, because they highlight that this is a complex situation, and it's because it's cross-sectoral nature. Yes, they focus very strictly on counting, like seeing the problem that we have no quantifiable evidence about specific diseases under these new conditions, or calculating calorie availability. And despite that this is incredibly important in many ways, I am wondering if under these circumstances that we are now living, this is the right way of use, the best way, not right, best way of using our resources. Is it asking the right questions to create actual solution and identifying what we can do? And I know that health researchers are in a difficult situation because we are specialized in something specific. And then, so how do you create solutions so that if your expertise is to diagnose and identify certain diseases? And I'll get back to that, but I said there isn't possibility to do this gloom and doom messaging. But I, as a health promotion scholar and practitioner, I know there are studies, and I know my empirical experiences that scaring people off, the same was with smoking, doesn't stop people from doing something. It doesn't change behaviors. It oftentimes creates paralysis. I think for the political decisions, it's incredibly important to do some calculations of the quantities and calculations in economic numbers and highlighting the overview. But I think that it's worth thinking is how many of these do we need to demonstrate that we have a problem? And I am now starting to invite you to start thinking slightly differently. And this is an interesting study by Shilbach et al., and this was a systematic review. They looked at 1,700 publications on projects on climate adaptation done in low and middle income countries in the world. And what they discovered is actually 2/3 of those publications talked about health outcomes, not necessarily having people who were health researchers, so very narrow interpretations of health outcomes. But the other thing was that they were also very positive about that their projects were influencing positively. The authors note that it could be a publication bias, but only 3.5% of those 1,117 papers that talked about health outcomes reported negative health outcomes. What is problematic from my perspective, and I think important for your future research, would be that there were no papers. None of those papers talked about maternal or child health. And I think there's a huge potential there to actually start working with environmental researchers, geographers, GIS experts, in terms of people who work on different fields to really focus on and create knowledge and action on this incredibly important field. Because that's the future of our species. It's the future of our children and grandchildren. So I sound like an advocacy person, but I just try to sort of stimulate the thought is that I'm not the only one who has been looking into this and is interested in working on this. That's the reason why I studied also environmental governance. But Witherspoon, who's the other author here, she is the CEO of the Children's Environmental Health Network in the States. And we who have been talking to rooms full of people, now I'm not sure if I already mentioned, but I've given workshops to health professionals and early years educators and teachers and social workers on children's environmental health. And it is so overwhelmingly paralyzing when you're just telling these facts, these problems that we are facing in the society without having really systemic empowerment. It is not enough to just tell that you can use this different washing detergent, or you can use you can get an electric car. We need more action, and one of them is to work with youth. So now I'm bringing this back to the global health research paradigm, and Vic was here, and I just wanted to bring in this research principles for global health research, but it's contextual factors at the local level, what we need to be understanding and identifying and acknowledging and integrating into our research. And also the question is that need to be working with people to understand what their needs are and what is actually a good adaptation for them, and working with building on their existing strengths, because talking about doom and gloom and just studying, actually I'm going a little bit back yet, studying what is wrong and what is the how vulnerable children really are, without providing any kind of solutions or working with people to developing them, is leaving us into that situation, the vacuum that we have had for 10 years, that we're doing very little for children's environmental health, despite the fact that it is related to a whole range of chronic diseases. The childhood exposures are influencing what is happening later on, and those I'm here at the end bringing an example from my previous work with, I was a First Nations, I was an climate change and health specialist with the First Nations Health Authority, and we built this program together. I was leading it, but we built this program to help the BC in the First Nations communities to address the climate change and health. And here is actually, this is not just in BC, this is all across Canada. This is the result originally of some visionary people in federal government, people who have worked with First Nations health for a long time. I think the key person has retired now, but they recognize that it needs to be community-led. It needs to engage youth, it needs to engage the traditional knowledge, and it needs to build capacity, strengthen the existing capacity. And this is a funding that is available for research across the country, has been for the past 7 years. And it's not a big money, but it's 100,000 per community that is searching it. And what I want to highlight here is that Indigenous kids, if any of you works with them, are even more vulnerable, not to climate change impacts. It's not just a transgenerational trauma. It's because climate change is actually threatening their identity, because the changing climate is changing the plants and the animals that are living in their territory. And not only that, climate change doesn't happen in a vacuum. It happens to already nature or land and waters that are already polluted, that are already influenced by urban sprawl, biodiversity loss. So it is children don't experience just climate change, they experience the whole. And so when we are addressing these problems that influence their health, we need to look at the whole, and we need to help them to become agents in that their own communities and in their own lives. And the key piece here was that we developed were twofold. We changed the name. The national name for this program is Climate Change Adaptation and Health Adaptation Program, but the communities in BC told us that we don't want to do adaptation for problems that we didn't create. So we changed it to action, Indigenous health, climate health action, so that they can choose themselves if they are addressing it through mitigation, adaptations, or whatever they want to do, because it's empowering them to make a difference in their own communities. And one of the things about that I probably forgot to mention was that this focusing on the negative, the risks, the vulnerabilities, and not focusing on strengths and assets is also re-victimizing people, and people who are already the most vulnerable, like children. Most of them know that in that situation when they recognize they have a problem, and at least their parents know. So integrating this kind of challenges into existing plans and trying to build what is already there is a way to really try to create change that is positive and improves or minimizes those risks, building on the strengths and assets. So I lost the track of the time, but I am asking now, opening up the floor for question, like discussion. In your field, how are the children's health and their vulnerabilities relevant to your work on climate change? If you starting to look at this from a more holistic perspective, what are the different mechanisms in your research or work you could empower people? And I'm talking about empowering because if you're not familiar with Nina Wallerstein's reviews and the Lovelock's reviews of value and importance of empowerment in improving people's health, then I recommend those. The one is from WHO's 2006, so it's not new. And then I'd like to ask you if you can see in this as addressing any of these aspects of climate change impacts on child health. Are you able to engage youth or children in your next research? Those of you who are doing just science in the labs, what are the ways in which you could use citizen scientists, kids or youth, or community researchers conducting interviews, so co-learners, or them as advocates and educators, or as solution seekers with you, because they are experts about their own life, or teachers on their own terms, teaching us about what they see and how they feel, and creating new kinds of health research that actually, at the same time as we're collecting this data, we're also using the data and learning to use the data better. So that was that. Thank you. And I'd like to open the floor for conversation.
Thank you very much, Päivi. I was going to say thank you for reminding us about the importance of transdisciplinary research, transsectoral, and co-created research with communities. But I'm going to change my language and thank you for challenging us. Maybe gently, maybe not so gently, but thank you for that. And I hope that many of us will take up that challenge. I see there's a hand up. And so if you'd like to unmute yourself and ask your question, please go ahead.
So thank you very much. That was extremely helpful. I'm Zulfi Bhutta. I'm the chair in Global Child Health and Policy at the Center for Global Child Health in Toronto. I also head a climate change program now across Aga Khan University campuses, but I'm a newbie in this area. Two quick things. Firstly, I completely agree with you, particularly from a low and middle income country perspective, that in talking to people, talking about adaptation, particularly to the young people, is very defeatist, and I generally get quite a lot of pushback when I speak about climate adaptation, even in urban situations. People want to see mitigation. People want to see some positive action, which has got less to do with their own ability to just adapt and just principally grin and bear it. So I do think we need to change our lexicon, and I like your climate change action approach, and that's something we might want to think about. I wanted to fill in maybe some evidence gap around the MNC, the maternal and newborn field. I think there's some very important data, I put that in the chat, from the Catalonia experience to indicate that perinatal and newborn mortality went up during heat shocks. The relative risk of infant and newborn mortality was 1.53 in that experience, and it was very well documented in epidemiology at the time. The sad thing is really not been followed up by other studies, not even during the urban heat shocks that we've had in South Asia, by looking at the interface of maternal and newborn health, where 50% of the under 5 mortality is clustered. So we do need some of those hard numbers in order to get impact on what this might be happening. If the relative risk of mortality in Spain was 1.53, you can well imagine what it might be in urban Karachi or in urban Delhi in the middle of extreme climate-induced heat shocks. Thank you.
Thank you for that, and I really appreciate that. I know the study, so I'm very happy you brought it forth. I struggled trying to decide how much data do I bring here, or how much do I try to develop the overview that we can start working on this. And I'm actually inviting you and others who are on this call, is that maybe we can have a workshop where we are picking up, working on this theme in the terms of we each bring the knowledge that we have, like these different studies, and start trying to think, so how can we do it differently? Who could be collecting that type of data? What type of that hardcore data? Because I agree, we do need it. Like, that's why I brought that one example from the States, is that we need the hard data, but together with the hard data, at the same time, we need translation to politicians, but also thinking, so what does that imply? What does that mean to midwives? What does that mean at the community level? What do we need to be doing and knowing and being aware of? What are the consequences, and how can we start mitigating and adapting to that, and creating systems that are actually changing the way we do things? So that, I thank you so much for that.
Thank you.
Anybody
Are there
else?
are there any other questions? Because I was reminded, Piva, when you opened and were talking about Canada being a leader of it was the Sandbox Project led by Kelly Leach, Dr. Kelly Leach. And I know that people here, Susan Elliott, for example, was one of the leads on one of the pillars in that Sandbox Project. I'm sure other people were involved with that as well. So thank you for that history lesson too. Are there any other questions or comments?
Any thoughts from your own field, or is this totally out to lunch? Is that, you see, what kind of knowledge would you need to even get going if this is so new to you that you not even familiar with? Or if there are like these sandbox people, what can we do differently? That is, how can we challenge ourselves? Because we've been working, I was in Ontario in the OPHA and Canadian Partnership for Children's Health and Environment, and they were champion projects, but they died. I'm just giving an example that people felt that it was too overwhelming to be trained as a community champion. So it sort of didn't go anywhere. So we've tried a lot of things, but maybe there is a way to do it through research, action research, where we also collect this hard data.
Piva, you have another question.
Okay.
Janet and then Zulfikar.
I was really impressed with the systematic review that was done by Helden, I think, Hellden, because I thought that they systematically kind of laid out what evidence we have at this point, and the framework that they used for understanding it might be quite useful, because if we're trying to influence people, sometimes a framework or a picture of showing associations, and then people can find their box, so to speak, where they can actually feel more comfortable putting their efforts, because it is a whole systems approach to addressing this. And I worked on the Green Plan way back with the federal government, and helped with the memorandum of the cabinet and all that, and saw it all be, even all the evidence being taken off websites with the conservative government. So one of the things is to try to protect the ongoing evidence, so that we're not vulnerable to changes in government. And the final thing is that I think the time is right to mobilize with our national governments to take this forward to the governing bodies, whether it's WHO or some of the UN bodies, to see what resolutions might take place that could consolidate some of this evidence and thinking. Thank you.
Thank you for that. And thanks for the work that you did, because it was excellent. That's what inspired me into children's environmental health.
It was exciting.
So if I may just add to what I said without, hogging the floor too much. So two things. Firstly, I've been on calls recently where there's been much discussion on what should be the Canadian agenda on climate change. And I've been a bit dismayed about this, because there's nothing like a Canadian agenda. I mean, this is a global agenda. And I think dichotomizing and separating out what may be priorities for work in Canada from what we need to do globally is fundamentally a mistake. So I would urge this group to advocate for a much more integrated framework of thinking and research around climate change and health, particularly looking at this as an issue of planetary health and a single global health agenda. In that sense, I'd like to point out that one of the things that my group is planning is really to hold a workshop, bringing together a think tank of sorts. So looking at research priorities for climate change in the context of health with low and middle income countries in mind. But I'm pretty certain some of those would be of great relevance to Canada and similar geographies as well. We plan to do it this fall, and I would certainly like to invite this group to participate in that towards the latter end of the summer, early fall. Thank you.
Thank you very much.
Particularly,
sorry, Pivy, go ahead.
No, I said it's okay. It's just, I just said that I thank you for that, and I also think that that it is incredibly important to address this, and I think global health research sees that more than anything, is that it's incredibly important that we address these. And I know, working with First Nations so much, and the Sami here in Finland, the Arctic, I know that oftentimes when people are brought together, the North and the South particularly, they find a lot of common ground. And then, truthfully, I don't think most of Canada or most of Finland is that different, because the climate change is hitting hard, and we need to address it. And we need to, I personally think that child health, we really need to bring it to the forefront. And when I talk about Canadian leadership, I don't mean limiting it to Canada. I mean it just, I think that there is a good solid number of people who are reaching to this point where we are seeing in different fields how we need to work together, and how we are understanding the importance of engagement that is necessary, the transdisciplinary engagement. And now, having worked primarily in Canada and a little bit in Europe and in Latin America and Asia, I think that Canada has something to give from this participatory perspective, and which may be because we have the in environmental governance, the indigenous component so strong that we have a lot of research in environment and little bit in health about those participatory approaches combined with the hard science. So I think we have something to go there, to build on.
Thank you. We have a question from Olusola, and then the last one from Janet, and we may be pretty much out of time by then. Olusola.
Yeah. Thank you very much. Thank you for the presentation. I would just like to know how much of your work is done in Africa. Quick question and then my comment. Yeah.
Unfortunately, none of my work is done in Africa because my expertise is northern contexts, but I work with people. So I believe that it is important to work together, but my work is not in Africa. I would love to work with people, but that's a whole different discussion.
Okay, like you mentioned in your discussion, the issue of climate change and child's health is so complex and it's layered like the onion. You keep peeling and peeling. So within I'll speak more within the African context. And the issue of climate change as it relates to increasing temperatures and heat, the heat wave and dehydration. These are all linked together. In the past 5-6 years, there's been an increasing rate of kidney-related diseases among children in that part of the world. And I was wondering whether this is linked more to dehydration, supposedly, because I don't think it's more of genetics, but I think it's more environmental. And what my thinking is, perhaps we could take this level of engagement to the community. In that part of the world, people rely so much on faith-based organizations because there's so much that UNICEF and WHO can do in this instance. We need to take it down to the faith-based organizations as well as schools to educate, to engage in how this kind of diseases or the impact of climate change, whether it relates to flooding or increasing temperatures, does really have negative impact on children's health. Thank you.
I really appreciate that, and thanks, and I hope that inspires a lot of people. I want to say two things. One, for the science, and I think that's an incredibly important in that kind of a research where you have that's observation that there are these kidney issues. And I wouldn't be surprised if that's a combination of a low dose toxicity and dehydration, but that would require medical experts that have more knowledge than me, because I'm just a biochemist. But the other thing is that that's what I'm talking about when I'm talking about bringing different ways of knowing. So we have an observation and then we go to communities and start working with the communities, exactly like you said, with not just the big national, international, but the ones that are staying on the ground also ongoing, those that are empowering, that the people trust, because the trust and power relations are big important factors, and the trust in the community to the people, and that the people who are working are going to work there also over a long time is important. So that was, I completely agree with you. And then I have to admit a little embarrassing thing. I am actually now working in Africa, but I forgot because it's a European Union big funded and 16 partners, and I'm working with a citizen science lab on pollution and climate change in Burkina Faso, but I haven't had the luck yet to go there because of COVID. So there's a little opening in my horizon.
Okay, thank you.
I am inviting people to start building this conversation.
Really appreciate that, Janet.
I defer to anybody else. It was just the comment about circumpolar organizations and associations that have done a lot of work in public health. We want to make sure we include them.
Yes.
Great, thank you. Päivi, thank you for catalyzing a wonderful conversation and a series of actions that I believe I'm okay, given that there are so many climate change working group members here, that we will be willing to pick up and engage with whoever is interested, and we'll follow up with people on that. So thank you for that. And it was serendipitous, but the conversation will continue because Denise Thompson from the University of Alberta is our next speaker on February the 8th. And she will be speaking about sparking global collaboration, the Cochrane Climate Health Working Group. And so Cochrane has a global working group that we're interested in connecting with and engaging. And I think that some of this conversation is really important and useful to bring forward to that next presentation. So as I say, that's on February the 8th. So watch out for the poster and the reminders on that one. So with that, it remains to thank Lauren for all of the logistical support, to thank Pivy for a wonderful presentation, and to thank all of you for engaging in this discussion and making it what it was. So thanks again. Enjoy the rest of your day. And again, you can check out CAGH and the Climate Change and Health Working Group online. So you're welcome to join us. Thank you very much.
Thank you for coming, and thanks for having me here. And I'm looking forward to us taking this to the next level. I'm just reading, don't close yet. I'm reading all these.